We are very excited with regards to our CoolSculpting technology because I think there's been a lot of devices and non-invasive things in the past that have promised people fat reduction and maybe haven't delivered.
So with the CoolSculpting, it uses a freezing technology, which would be like an ice. So it uses cold basically to freeze the area, and that targets fat cells. So you do get a fat reduction of about 20% each time we place the applicator on.
And then we have a heating technology such as My Venus Legacy, which can give us tightening and pore reduction and cellulite improvement. Again, no downtime, no discomfort. Most people are so surprised it feels like you're at the spa, and getting really effective results in sometimes difficult to treat areas of the bodies. Where I also find we bring in the heat part of it is we've got a more of the diffuse area. So we've got an area that is along the thighs or in the buttocks, or maybe something where you really can't maybe necessarily grab as well, because with the CoolSculpting you actually have to, there's a vacuum component to it. It has to be able to suck up, and sometimes some fats aren't just applicable for that. So that's where we really can use the Venus Legacy to really give that smoothing, or in some areas which maybe the outer arms, which maybe are a little technically difficult to do with CoolSculpting. So it's kind of a little bit of a component of both, and they get results that frankly compete with surgical procedures.
Being able to walk in and say, you can complete the treatment, you're only really halfway there, give them more of a complete solution, show them that how, rather than use CoolSculpting multiple times, it isn't the only modality that you need, that you then have this other modality that you can complete that treatment with no disposable factor. People are pretty receptive to that, and I think that's probably why I've got about, I think 9 or 10 accounts that have both. That I have physicians that will say, if you have CoolSculpting, you need something like the Legacy, and the Legacy is obviously the king of all RF devices out there, to help complement that. So I think when you can come in and explain to the physician why you're not going to get the tightening effect. Now, there is what everybody does have to be aware of is that some of these LT reps might go out and say, we have evidence that shows we do skin tightening. And what I want every rep to be aware of is that particular study with Grant Stevens showed about a 16% rate of skin tightening. And I don't know about you, but nobody's getting FDA clearance with a 16% response rate. I personally feel that it wasn't due to the cryolipolysis effect why there was skin tightening. It had to do more with the handpiece, the way it sucked the tissue and stretched the tissue, much like our Varipulse can induce a collagen effect. That suction on for an hour can help the effect. Now, going beyond that, there's so much to talk about, because even if somebody has a CoolSculpting treatment, where the pulsed electromagnetic fields can come in is if somebody has numbness, pain, as soon as they can start those Legacy treatments, it will actually help that result with CoolSculpting to initiate that body healing process even quicker. There is no one modality that will always do it all. Sometimes heat doesn't work and sometimes cold doesn't work. But when you have both modalities to go to temperature extremes on both ends, you can encompass